I'm going to begin my video by doing an assessment of the thorax and lung. First, you want to notice your patient, how they're breathing, how their respirations, if they're even or unlabored. And you can act like you're going to get their pulse to get their respirations. Look at their skin color, look for cyanosis. Look at the shape of the chest. Notice any abnormal shape of the chest, such as barrel chest. She is setting her positions good. Facial expressions good. She's not having any trouble breathing, and she's alert. After you inspect, you need to palpate. Confirm symmetric expansion by going to the 10th ribs. Raise your shirt up for me. It's right above the sternum. You can notice the thumbs. Take a deep breath. Notice the thumbs, how they're equal and symmetric. And next, I want her to turn around. That way we can do the palpate for the tactile fremitus. You can raise your shirt up for me, leaving the front. I'm going to have you to say 99, okay?
Okay.
Ready?
99, 99, 99, 99.
Okay. You want to see if the vibrations are symmetrical and they're moderate, and that's good. You also want to palpate the anterior and posterior thorax and lungs to notice for any masses or lumps or lesions or tenderness anywhere. After palpation is percussion. With percussion, you use the middle finger. And you have to do this anteriorly and posterior. You will hear dullness like over the over the ribs and the heart and the diaphragm, and you will hear resonance over the lungs, and you'll do that anteriorly and posteriorly. Doing the diaphragmatic excursion test is where you will do percussion, and then you will mark the areas where you feel you have the patient to exhale and hold it, percuss down until the sound turns to dullness on each side, and you will mark on each side. You will do that, and you will measure to see if they're symmetrical. I only have 2 stickers, but I will show you. See, take a deep breath and hold it. Take it, blow out. And you have the patient to take another breath. Take a deep breath and hold it. And then we will do that on both sides, and you would want that to be symmetrical, and you would want that to be about 3 to 5 centimeters would be normal. After percussion, you clean your stethoscope with alcohol, and we can auscultate. Just take some deep breaths for me. Her lungs are clear. You have to auscultate anteriorly also. Also, when auscultating, you want to perform the bronchophony and the whispered pectoriliquy and the egophony. I'm going to have you to say 99 for me.
99.
Again.
99.
Again.
99.
Now, can you whisper 1, 2, 3? Okay. And next I want you to say E.
E.
long. Say E.
E.
One more time.
E.
Okay. Those were both normal when she said the 99 and the whisper, the 1, 2, 3. They were faint, barely inaudible sounds. And then when she says E, you don't want to hear the patient say A. And next we will go to the heart and the neck vessels. You can lie down for me. I want to begin by observing your patient's carotid pulse. Observe and palpate and listen. And you want to palpate each side of the carotid pulse, not together, do one at a time. And to estimate the jugular venous pressure, you'll place your ruler here at the top of the sternum and look for the jugular vein, any pulsation in the jugular vein, and measure. You also need to find the apical impulse, which is usually the 5th intercostal space on the left side. And you want to notice any heavy lift or thrills. You want to listen to the heart. You also want to listen to the heart and the carotids with the bell of the stethoscope for a Brewie. We've got aortic, pulmonic, Erb's point, tricuspid, and mitral. You want to notice the apical rate and rhythm. Hers is regular. And I did not hear any murmurs or any S3 or S4 sounds, no gallops. Going on to the peripheral vascular system, you can set up if you want to now. You want to inspect the arms, noticing the color, the size. They're even, they're pink, and they're warm. No lesions. You want to palpate the radial pulse and the brachial pulse. You also want to do a modified Allen test. Okay, I'm going to put some pressure here, okay?
Okay.
Now make some fists for me. Do it again. Make a fist. Okay. Just relax. Okay, that's a good test. You've got a good blood flow there. You also want to look at the legs, noticing the color. Look for any vein distension, spider veins, any edema. She has no edema in her legs, and they are also warm. If she were to have the varicose veins, you could do the manual compression test to check the patency of the veins. Also the feet, you want to check them for edema and the temperature. And you want to check the pulses in her feet to see if they are equal. And she has a 2+ pulse, and they are equal. To do the femoral pulse, it's right in the groin area. It's kind of, I'm not going to ask her to undress. And the popliteal is behind the knee. The posterior tibial is here, the inner leg, the inner of the ankle. And then the dorsalis pedis, which I felt before then. And this will conclude the video. Thank you.